So in our study of the lower limb muscles, we know that there are 9 compartments of muscles that we want to be able to identify, and then we want to identify the muscles within those compartments. So this presentation focuses on the anterior muscles in the hip area. So first, it's best to identify the various compartments. In this picture, you can see 2 hip compartments, the anterior hip and the posterior hip muscles above, and then the medial and anterior thigh muscles. So we're going to focus on the anterior hip here, and this is an interesting group of muscles because most of the muscle is up inside the body cavity. Here's a picture of that anterior hip area. The anterior hip muscles extend from up inside the body cavity down and out. Here's somewhat of what it would look like if the abdominal wall muscles were present. So you can see those abdominal muscles cover that abdominal cavity. Without them, then we're looking into the cavity and we can see the iliacus muscle and the psoas major muscle. In most pictures, the ones that are superficial, these 2 muscles only have about 10% of the muscle showing, as you can see here, sticking out into the upper part of the thigh. So let's look at the 2 muscles one at a time and identify them. As we often indicate, many things within the name of a muscle will help you locate it, and this is a great one. Here's the iliacus muscle up in the abdominal cavity, and you can see it coming out from under that white cord of connective tissue, which is called the inguinal ligament. Remember, inguinal is the term for the groin area. And so you can see a little bit of it sticking out into the upper part of the thigh area. The 2 muscles show nicely down in the line drawing there where all the other muscles are out of the way, and you can see the iliacus muscle over to the right anchored onto the ilium and then connecting down into the femur. And origins and insertions here are pretty easy if you know the bones, because you can see that iliac crest. You know on the medial side below the crest is the iliac fossa. And then if you know the femur, you can see that the muscle comes to the medial side of the femur. You can see the greater trochanter. Perhaps you can imagine that muscle crossing over the neck of the femur and attaching on the medial side of the femur. The one major feature that you would recognize there would hopefully be the lesser trochanter. And in reality, both of the anterior hip muscles anchor onto that lesser trochanter. So I think in the picture you can see them coming together. So if you focus on the iliacus, you can see that the origin is right there where the iliacus muscle is. The insertion of the iliacus then is down here, so you can't see the bones clearly here, but I think if you take the line drawing and then go back and forth, you can see how those go together. And the other muscle then that's in this anterior hip area is called the psoas major, and it's side by side. It's on the medial side, iliacus is on the lateral side. In the model picture, you can see the femoral nerve there, which is an important landmark as well, and comes out from between those 2 muscles when we dissect the cat, we see that nerve coming from between these two muscles there as well. And we have the psoas major muscle with its origin up on the vertebra. The colored picture doesn't show this as well as the line picture, but you can see in the line picture that all attached there. And then, of course, the insertion is the same as the psoas major onto the lesser trochanter. So this is the smallest group of all the muscles we're studying, with only two muscles here, the iliacus and the psoas major. And again, in most superficial pictures, you're only going to see a tiny little wedge out from under the body wall. And sometimes you have the nerve in a picture, sometimes you don't, but you know the two little muscles that you see up there are the iliacus and the psoas major.